Dear friends, topic for the day is tsunami of neglected neurogenic bladder after spinal cord injury. Can we undo the damage? And I am your host, Dr. Dinesh Suman. The history of spinal cord injury is as old as the history of mankind. The oldest records date back to 2700 years ago when Edwin Smith wrote about spinal cord injury in those times. Ever since those times, spinal cord injury has remained the deadliest affliction known to the mankind. Most of the patients who suffer from it will succumb soon thereafter. Trevor Hughes wrote the first scientific records. Spinal cord injury was labeled as an ailment not to be treated, and the gloom and pessimism continued for thousands of years through the Middle Ages. Everything was tried, but since the knowledge about the etiology, pathogenesis, pathophysiology and treatment modalities lacked, science was poorly developed, everything was to no avail, and most of the patients would succumb soon thereafter. As recently as in 19th century, Lord Nelson received a gunshot bullet and died soon thereafter. President of USA James Garfield received a shot in the spine in the lower back as incomplete conus cauda lesion and succumbed within less than 3 months. World War I saw millions of casualties, and all those people who had suffered from spinal cord injury died within a few weeks thereafter. This was a huge disaster, but it gave its own lessons. Thompson Walker was the urologist, and he said management of the bladder in the First World War was the surgical failure of the war, and he realized the importance of management of bladder in patient survival. Benjamin Franklin had made first silver coil catheter, and besides this, a number of other materials and shapes of catheters were used to drain the bladder, but they were not as effective in order to maintain a continued, a sustained and irregular drainage of the bladder, and tended to cause more infections, more problems, and patients would succumb to it soon thereafter. It was not until 1929 when Frederick Foley came up with an innovative idea of a Foley's catheter retained with a balloon. This provided a suitable method to provide continuous drainage to the bladder. Donald Munro made use of the catheter, treated his patients as a complete rehabilitation persons, and demonstrated to the world that all is not lost. Rightfully, Donald Munro is called the father of paraplegia, an optimist who refused to accept the defeatist attitude, opened his first center in Boston City in 1936, and his success paved the way for the treatment of an ailment not to be treated. He used tidal drainage to prevent recurrent UTIs and claimed complete responsibility for the whole person. He influenced US Army to establish US centers. However, even in World War II, the pessimism in certain areas prevailed. Journal George Benton, after receiving cervical spinal cord injury, refused all forms of treatment and died soon thereafter because he knew there was no cure for it. This pessimism persisted till Sir Ludwig Guttmann, a Jew himself, escaping from Germany, coming to England, reaching at Stoke Mandeville Hospital, took up the challenge of caring for SCI, and he established a lovely center. He took up the complete responsibility of his patients with total commitment. He was also a believer in wheelchair sports. He founded the Paralympics. He also came up with the idea of sterile indwelling catheterization to beat the infections. Those were the times when antibiotics were hardly there. There were no advanced antibiotics in those era, and sterile indwelling catheterization gave life. Paralympics brought patients from various districts, from various countries together, and they saw hope and felt rejuvenated. And certainly after the World War II, there was a wave of enthusiasm. Bors and Kama were the urologists who worked in the field of understanding of neurourological conditions and gave principles in neurourology, of a lot of which we understand today. They established the American Paraplegia Society in 1954 and established a comprehensive care center. Neurourology gave way to the principles of optimal bladder care. Norman Gibbon also worked at Stoke Mandeville. He worked hard, carrying his manometers, worked in the field of urodynamics, and gave Gibbon's catheter to the world. He was interested in the management of paraplegic bladder. David Thomas also set up a detailed urodynamic and radiological screening service in the spinal unit, understanding the great importance of bladder management in spinal cord injured people. It was John Young in USA who gave a model care system, organized the services which were random and scattered so far, and he gave the principle of injury to grave care. His model system still exists in USA and serves as a role model. Jack Lapides in 70s evolved from sterile to clean intermittent catheterization, and it revolutionized and took the care of catheterization to every single person in his own hands. Further, the development of a variety of antibiotics provided the safety from infections, from ascending infections going up the kidneys, of septicemia, killing the patients. And it was this time when urodynamics evolved from the primitive methods, when electronics and other circuitries came into being. We now have advanced urodynamics and video urodynamics to understand the pathophysiology of neurogenic bladder. Development of an endoscopy to be able to view inside gave us better instrumentation to diagnose the conditions, to diagnose various complications and manage them non-invasively. Development of series of anticholinergics starting from oxybutynin to tolterodine, solifenacin, darifenacin, and a number of others led to significant change, although cognitive impairment remains a significant side effect. Development of alpha blockers helped with cases of bladder outflow obstruction and also helped the patients with neurogenic bladder who were self-voider or who could void reflexively. Development of beta-3 agonists in the 21st century, as mirabegeron and its successors, have also paved the way for safer management of detrusor overactivity. Development of Botox as a drug has given rise to significant improvement in the management of a drug-free, without drugs, the bladder overactivity. Use of a Brindley stimulator and InterStim has also brought about revolutionary change. We have peripheral nerve stimulation in the form of PTNS and genital, sacral and calcaneal nerve stimulation and sacral nerve stimulation, most of which may be done from outside. And beyond this, we have evolved to personalized, tailored care, whereby we understand the principle of tailoring the therapy to treat the person and not just the disease. And as a result, in last 1 century, we have seen the world evolve in a very optimistic manner.